So I do this thing on Instagram where I kind of recap my shift on my story, so I figured I'd bring that to TikTok. Let me know if you like it. The last 2 days I worked in the ER, and I work at one of the busiest ERs in my area. The other ones are not always staffed appropriately, so they have to defer a lot of cases away, making us even more busy. So the past 2 days, my first cases of the day were hemoabdomens on very unsuspecting owners, and honestly, I was even very unsuspecting of the first one, which made it pretty sad to break the news to the owner. Literally before I even logged into my computer for the morning, I was dealing with these cases and having to tell owners the bad news. On Thursday, there was at least a third doctor on with us. Usually there is one inpatient doctor dealing with 16 inpatients and me to deal with every single patient that walks through the door. So that's why there's wait. I cannot see 20 things at the same time. But we had a third doctor to help with outpatients, so that took the caseload and helped even it out a bit. Yesterday, it was just me and the inpatient doctor, and she was dealing with 14 or 16 inpatients. I can't even remember. And when I walked in at 10 a.m., there were already 8 things waiting. Like I said, my first one of the day was a hemoabdomen. Then I had a delayed spay dehiscence. I had a blocked cat that was supposed to be pretty simple and got more complicated. I had a terrible bite wound dog that I had to sedate to kind of readdress her wounds and ended up having to euthanize her. Meanwhile, my boss was doing surgery all day. She had to euthanize one on the table, and one died before we got to surgery. But she did do a C-section, and 2 of the 4 puppies lived, which kind of brought joy to the whole clinic as we were fawning over these puppies, because it was the best part of the day. But because both doctors were doing surgery and sedated procedures all day, that made the wait times even longer because we couldn't take any new patients until we had sedated all of our current ones and fixed their issues. So just a little insight on a day in the life in the ER. Please be understanding and patient with your vets, please.